Hi, my name's Molly and I'm a young ambassador for the Brain Tumour charity, and I'm joined by Selina, who's a clinical neuropsychologist at Salford Royal Hospital. Hi, it's nice to meet you.
Hello, and you too, Molly.
We know that for people in our community, a big problem can be struggling with low mood. What advice would you give to those who have been diagnosed and their loved ones?
Yeah, a really difficult time, and often a time when there's lots of questions, sometimes without a clear answer as well. I think, practically, sometimes there's some very clear things that need to be put in place for a future date, which can be very, upsetting. That might be around finances, health, or even adaptations. And there's loads of really good support available through the charities or the NHS Trust to kind of signpost for that support, and that won't have changed at the moment. That support and advice is still present, and I think once those kind of practicalities have been actioned, focusing again on kind of lifestyle factors and just getting back to the basics of that is really important, and also just being present in the here and now without kind of allowing your thoughts to trail too much to kind of potential future outcomes is really beneficial. So kind of doing what matters in the here and now with your loved ones. And if you need, there are places where you can access support for your mood during this time. I guess the biggest difference is it might be, by video or on telephone.
What strategies for managing low mood would you give to those who have been diagnosed with a brain tumour?
Yeah, this can be a bit tricky, actually, I think, especially if your motivation has been affected anyway. And I think probably the first step is just recognizing, that there has been a change and making small steps to put things in place to support your mood, like the lifestyle things, and about being more present. I would say that sometimes you can't wait for the motivation to return. Sometimes you need to kind of push yourself perhaps a little bit just to make a small step in the direction you want to be heading, because I think it's unlikely you'd regret giving it a go. Sometimes I often think about the phrase, don't let what you can't do get in the way of what you can do, because there's often so many things that have changed, but if there's something similar to what you've enjoyed doing previously that you can adapt, then doing that does really support people. And I think just most importantly, being really open with other people about how you're feeling, whether that's people you live with, friends, family, or even other professionals, just being able to access and know who to speak to and how they can support you is really useful.
Are there any specific strategies that you'd give to those that are caring for a loved one with a diagnosis?
Yeah, I think probably giving yourself permission to have time for yourself and to connect with your support networks is really important, which might be a video call or, making some time to relax or engage in one of your interests. It's also quite good to keep your mind active, having a go at a jigsaw or a puzzle or colouring or something that's going to keep you busy. But it's also nice to make time to be together, which might be sitting in the garden or watching a film or, going through old photographs. So just making some time, to do things on your own or with your loved one is really nice and important.
When should people access further help, and what's the best way to go about doing this?
Yeah, so I guess there's two aspects to this. From kind of a mental health point of view, I think if you're concerned about your mood or the mood of a loved one, you can contact a number of people, whether that's, the charities are working really hard at the moment to provide additional support. Your specialist nurse or your GP can also signpost you. And I think a lot of, certainly within the NHS, but I think within the charitable organisations too, people have increased their capacity at the moment. So do pick up the phone, do look on the NHS and the government websites. There's also lots of practical advice about kind of financial concerns, which will obviously affect people's mood as well. From a symptom management point of view, contact your usual consultant. It's no different than the advice from beforehand. I think sometimes our anxieties can be raised if, a routine scan has been rescheduled or a consultation has been postponed or maybe is moved to a telephone conversation. But any concerns that you have at all, then do get in touch with your consultant, or your specialist nurse. be reassured that the support is still available and there should you need it.
And finally, what would be your top tip for coping with low mood?
Yeah, I'd say don't leave it. If you feel you want to reach out to someone, then do. And it might be professional, someone you're close to. I would also say, try to make time for a bit of relaxation or mindfulness. Some people find it helpful to put a bit of time aside for worry time, which might be half an hour or less, but kind of jotting down anything that comes up in your mind that you're worried about during the day, and saying, right, well, I'm going to think about that between 4 and 4:30 today. That's going to be my worry time. And by the time you get to the list, you can then decide if there's anything you need to action or if you can sort of let go of some of those things. It's all part of that, kind of controlling what you can control and feeling like some of the other things that you need to let go of and maybe shift your attention away from that. So I think broadly speaking, there's something really important about just controlling what you can control and letting yourself off the hook a little bit for things that are outside of your control.
Great. Thank you so much for talking to us today, Selina.
No problem. Thank you for your time, Molly.